Select the appropriate tube size for the patient. Check the tube for proper inflation and deflation. Completely deflate the tube prior to insertion. Lubricate with a water-soluble jelly. Pre-oxygenate the patient with 100% oxygen. Insert the LMA into the hypopharynx until resistance is met. Inflate the cuff until a seal is obtained. Connect the LMA to an ambubag and assess for breath sounds and air entry. Confirm tube placement using Untitled CO2 detector or esophageal bulb device. Monitor oxygen saturation with pulse oximetry and heart rhythm with ECG. It is strongly recommended that the airway, if equipment is available, be monitored continuously through capnography and pulse oximetry. Re-verify LMA placement after every move and upon arrival in the ED. Document the procedure, time, and result, success, on or with the patient care report, PCR. It is strongly recommended that an airway evaluation form be completed with any BAD use.